So like Kyle said, my name is Dana Lehman. I am a psychologist at AIDS Care Group. We are down in Sharon Hill, which is about 20 minutes south of Center City, Philadelphia. We do HIV care, we do opioid addiction treatment, we do queer-centered healthcare. We do a lot of things. We run around a lot. And I work here as a supervisor. Been here for about 2 years. And so my pronouns are she, her. I go by Dana. I'm pretty informal. You know, Ren and I had originally imagined this as mostly a dialogue with all of us, you know, sitting in a room together chatting about these issues. Obviously, that was pre-COVID, and so we've changed the formatting around a little bit. But just to echo what Kyle said, we really encourage questions as much as possible. It'll be far more useful and far more interesting than just listening to the two of us chat for the next hour and a half. So please do that. And beyond that, also echoing something Kyle said, it feels really important, I know, to both of us to kind of acknowledge what is happening in the world right now. It has been a particularly challenging couple of months and a really horrific past week. And, you know, I think we have to really name how deeply our friends and our families and our colleagues, particularly those of color, are suffering and suffer in many, many arenas, not just sort of related to physical brutality, but also related to healthcare and sexual health. And so in that way, I'm hoping this presentation will be timely for everyone and that people can walk away feeling empowered to take their own healthcare into their own hands, as well as helping patients, friends, clients to do the same. So that is certainly our goal for today. And let Ren
definitely
go from there.
I think, yeah, I mean, I think that with everything going on, it's hard. We only have so much mental space and mental energy to be able to engage. And so I thank you and appreciate the parts of yourselves that you can bring here for this presentation, and also honor that, like, it likely is not 100% of us at this moment.
Sure.
So my name is Ren Kinnear. My pronouns are she, her. I am a psych resident here at ACG. I do a lot of work with our opioid program and also a lot of work with Mosaic Medical, which is our LGBTQ specific healthcare program. Yeah, I do want to let people know that the Q&A I have open on my window. So anything that you type into there, I can see, and we can kind of talk about in real time, and you can engage in the conversation in that way. Please do. I encourage everyone to do that.
Okay. So we thought it would be helpful to start with a discussion of what sexual health means. And I think one of the things that strikes me as particularly important is that that's a really personal definition. I think you would be very hard pressed to find two people who think of this and define it in the same way. And so, you know, when Ren and I were discussing, like, how do we talk about this? How do we include everything? We didn't really settle on like, this is a good definition to give everybody, and then we can go from there. But we did want to start out with the definition given to us by the World Health Organization. I don't know, Ren, if you want to read it to everybody. And maybe, I mean, I would love to hear some thoughts, kind of, how do people feel about this? Is this positive and inclusive? Are there things that are obviously missing? Are there things that you would like to see included? And maybe we can start sort of looking at that.
So World Health Organization defines sexual health as a state of physical, mental, and social well-being in relation to sexuality. It requires a positive and respectful approach to sexuality and sexual relationships, as well as the possibility of having pleasurable and safe sexual experiences, free of coercion, discrimination, and violence. I think one of the first things that stuck out for me in terms of this definition was that I really appreciated that positive, respectful, free of coercion, that all of those things were incorporated into the
really
definition.
Sex positive in that way. Absolutely. Yeah. You know, one of the things that, as I'm reading this out loud and we're sort of talking about it, I now am making a mental note to look up after this presentation is, I wonder how recently that definition was stated, because, it seems very sex positive, and it also, the acknowledgement of discrimination, of violence, I really appreciate that right now, particularly in light of this week. So I wonder if that's a definition that has changed a lot recently. I want to sort of look into that more. Is certainly something that comes to mind for me.
I definitely encourage anyone who's viewing who also wants to, has thoughts, please type them in. So as we went on to define sexual health, I kind of took the World Health Organization's lead in terms of splitting these things into physical, mental, and social well-being in terms of sexual health, and trying to think about what does that mean. So physical sexual health, I think the first thing that comes to mind for a lot of folks, even when you just say sexual health, people automatically go to STIs, right? Like, I think that that's a very quick, we think about STIs, we think about condoms, we think about like that kind of thing. And so I do think physical sexual health becomes like the prominent message, but it's not the only message. And I think that's really important to acknowledge. So, I'm thinking about STIs, birth control. When I think of physical health, I'm also thinking about functionality. Like, is your body functioning biologically the way that you expect it to, or the way that you need it to, in order to have like a pleasurable, positive sexual experience? And then also like physical sensations of pleasure, right? Like, how does your body react to different stimulation? And how is that impacted by your overall health? How is that impacted by the overall functioning of your body? One thing that I think is really important to acknowledge in talking about physical sexual health is that often even these things go back to a very heteronormative way of thinking about sexual health, right? Like, we talk about reproduction, like when it comes to functionality, we're talking about P and V, right? Like penis and vagina, like penetrative sex. We're talking about reproduction. And it seems to be that all of our physical health needs or focuses surround that specific action, which I think is not right? I think that there's so much more to your sexual health than that. And we need to widen the frame for how we think about our body functioning, to be inclusive of other sexual acts, to be inclusive of other, purpose for sex, right? Like, it's not just about reproduction, and it's not just about two body parts. Dana, thoughts?
Yeah, one thing I was thinking about when I was looking at this is, not only is it incredibly heteronormative, but it also in many ways feels very age specific. There's this way as a culture that we think of sex and sexuality as something that, young, but hopefully not too young, but young people do. And it's, either about getting pregnant or trying not to get pregnant. And it's really fun. And maybe you're in these interesting positions you've seen in porn movies, or whatever's going on. And you don't think about the fact that, sexuality exists across the lifespan, right? First of all, it's not just about sex, however it is you define that. And beyond that, the hope is that people get to have, a healthy relationship with their sexuality throughout their life, which hopefully is going to last long past young adulthood, right? And so, when you think about functionality, what immediately came to mind for me, and this is my own bias as a 30-something-year-old woman, is, could I get pregnant? Do I want to get pregnant? Is it going to work? Is it not going to work? My older clients who are in their 60s or 70s, who are female, are probably not worried about that, but might be worried about different issues related to aging and sexuality. And there is this way that we tend to immediately think of this in sort of a specific range of ages, a specific heteronormative state that is problematic and certainly not inclusive. Yeah. Was something that sort of immediately jumped out to me.
And may I ask a question or interject real quick?
Please do.
Yeah.
So when I hear physical sexual health, and I hope everyone's getting their thoughts moving and their juices flowing, we really want to hear what you think. When I think of physical sexual health, I really liked what you said about how one defines it, because there are people who do not enjoy penetrative sex, and in that case, how how do we talk to folks who may not be participating in the normative way of having sex? And also think about ableism as well, you know, like sex for folks who are differently abled, you know, they are often left out of the conversation. So
yeah, and I think just sort of piggybacking on that idea, there are people who are not interested in penetrative sex for whatever reason, or there are people who are very interested in it and for whatever reason, maybe because their bodies work differently, are not able to do it. And how do we approach that? You know, I think about it as a psychologist, but also as we're looking at sexual health care and talking to medical providers, how do we help people get the correct kind of attention and information that they need based on their interest, their ability, their stage in life, their personal circumstances, all of these things. These are, you know, there are many, many factors that need to be taken into account.
So I want to move on mental sexual health, right? So this is the second chunk that the World Health Organization identifies. And when I think about mental sexual health, I'm thinking about desire. I'm thinking about pleasure. I'm thinking about satisfaction. I'm thinking about what do you want from your sexual experiences? What are you getting from your sexual experiences? And also what's getting in the way of being able to enjoy your sexual experiences, right? What do you need mentally, emotionally in order to get the most out of the sex that you're having?
Right, I just want to let you know, so I was just looking at our question and answers, and someone just commented that the word functionality made them think about mental health and how that can affect their ability to have sex, especially penetrative sex. We certainly know, I think that's a very important point, that for many people, especially those with trauma history, this may be completely off the table. Maybe they want it that way, maybe they are physically just incapable at the time. And that's, you know, mental health, as you're starting to talk about now, just being a huge component. You know, I think as a culture, we also have this idea that like physical health is here and mental health is here, and you treat this one over here and you treat this one over here. And that does a huge disservice to people because of course physical and mental health is connected. I will not go off on my soapbox rant about that, but I'm so glad that we're talking about the mental health component here, because I think part of having your sexual health needs met may involve getting mental health treatment. And that's something that is, you know, very common and should be done, and there should be no shame around that. That's a great way to empower yourself to take care of yourself.
Yeah, I think if you look at the Q&A, someone mentioned recovering from religious shame-based sexual ethics.
Saw that, yeah.
Which is, I mean, that's right. Like, that's awesome. So what we have to do, what we have to unpack in order to be able to engage sexually in a way that feels right for us, in a way that feels pleasurable to us, like this permission giving, you know, and I think that can come from a lot of, it can be impacted by religion. It can also be impacted by society as a whole, right? Like how much permission for sexuality do we give boys over girls, right? When we talk about kind of in a large, right? And how much permission giving for sexuality do we give people at different ages? You know, think about
and who decides at what age it's appropriate to engage in what kind of behavior? You know.
Yeah. The other thing I was thinking in terms of like age, like thinking about folks who are aging and maybe are in like an assisted living of some type, and how much support is offered in terms of allowing them to engage in sexual health, or how much is that support withheld, and what does that tell them about how much of a right they have to have a sexual life within their living situation. It looks like there's a question down here.
I like, this is a great question. This question of, you know, it says, I appreciate the acknowledgement of the importance of pleasure's role in sexual health. Cannot be overstated. I know Ren and I are very strongly aligned in that. I would like to understand what factors may influence one's ability to feel satisfaction in their sexual experiences, particularly if there's no past trauma. I think that's a great question. you know, and as Ren was saying, you know, we're talking about physical, mental, social pieces. And so we're gonna, I think, keep coming back to that question throughout this presentation. You know, one of the things that is certainly important is if you are having problems sort of with physical sexual satisfaction, there are a variety of medical issues that can cause these issues. We're going to talk some specific HIV issues later on in the presentation, but one of the things that I think is really important is that you have a medical rule out, right? You know, just sort of off the top of my head, if you have diabetes and your blood sugar is running high, that is something that can cause erectile dysfunction. It can cause problems with lubrication for women. That can make sex really not feel so great. And so, you know, it's something that needs to be addressed. If you have really acute asthma, it may cause difficulty sort of having the physical endurance to really enjoy sex. I mean, these are just a couple of examples, and we'll keep coming back to it.
Yeah, I think one thing that's coming up for me, even as we're talking about in this question, kind of the separation of pleasure and satisfaction, that we talk about pleasure is really important, and that should be a part of your, you know, that can be a part of your sexual health. You're allowed to have that, but what is the difference between pleasure and satisfaction? And when I'm thinking of satisfaction, I'm thinking about coming out of a sexual experience feeling like, okay, yeah, like that was enjoyable for me. That was a thing, like I got what I needed out of that experience. You know, which can be different things for people, right? Whether that's
may or may not involve an orgasm.
Right, exactly. And so I think some of that is like trying to stretch our definition for what sex is, right? So you could say like, oh, well, I can't be satisfied with that experience because there was no orgasm, or I can't be satisfied with that sexual experience because there was no penetration. So was that sex? Like we didn't even have
count,
sex, you know,
or something,
right?
Does that count?
So I think, yeah, like the idea of satisfaction really comes, you know, I think is impacted by this, like, okay, big picture, what do we think about sex, and what allows us to feel like, oh yeah, like that was a good experience for me. That was I feel satisfied by that. Let's see, Kyle marked a question. The word functionality made me think of mental health and how it can affect your ability to have sex, especially penetrative sex. Yeah, I mean, I think we come back to that idea of the mind-body connection, and how does your depression impact your sexual functioning, right? Like how does it impact the way that your body reacts? How does it impact your ability, I think about anxiety, how does that impact your ability to be comfortable in your sexual experience? How distracted are you, right? Can your body function and focus on pleasure and sex? If we're talking about penetrative sex, talking about, you know, getting your body getting excited, right? Like having erections, you know, can you do all of those things if your brain is somewhere else because you're so overwhelmed by your anxiety that you can't even focus? I think it definitely has a big impact.
I'm back again. I mean, I interject one more thing.
Yeah.
Please do.
This all makes me think of how important consent is. You know, checking in with your partner, you know, if you're choosing to be with others during sex, you know, that's really important and contributes to, you know, the state you're in while having sex, you know. I was thinking about this and I was kind of joking to myself, you know, there's truth in the adage about like lighting candles, setting the stage, you know, making sure everything's right. And part of that is also consent with whomever you're choosing to have sex with, you know, because there can be times where you want to have sex with someone, but they do something that doesn't sit right with you. And, you know, that's all part of the process, and it's a continuum while you're having sex.
Absolutely. So. That's also a very nice intro to our next slide, Kyle. Thank you for thank you
Beautiful.
For creating that intro for us. Yeah, I think that point is really very important, especially sort of now with consent being something that I think most of us, hopefully, sort of across culture, are thinking more about, and how do you appropriately give consent, get consent, do it in a way that still feels sexy to you. I've had a lot of conversations with clients recently where they're like, well, I don't want to turn to my partner like right in the heat of the moment and be like, so do you really want to do this? Like, that doesn't feel so sexy. And how do you work that into a positive, healthy sexual experience, and make it part of the norm? Because, this is what we really need.
Mhm. Yeah, I mean, that's a perfect, segue into social well-being and sexual health. And I really think I'm hopeful that that's what the World Health Organization kind of had in mind when they added this aspect of like, how does your sexual health impact the relationship that you have, or how you navigate, or how does navigating your interpersonal relationships impact your sexual health, and vice versa, right? And so it does come up like issues of consent, thinking about safety, like what is it that you need from your partner, and impacts on the intimate relationships and romantic relationships. I think also when you're talking about, I think that your sex does impact your relationships, and how do you navigate that or discuss that with your partner so that your relationship is the way that you want it to be. I'm thinking especially in practicing non-monogamy or polyamory, and like thinking about like, okay, how do we like have conversations around this so that we feel like our sexual needs are being addressed, our sexual health, we're really good in our sexual health, and also that it's reflecting the type of relationships that we want to have with the people that we're having sex with. Any other thoughts on that, Dana?
No, not at the moment. I think you covered that really nicely. So sort of moving into this piece about providers. Little disclaimer here. The point of this talk is not to in any way bash medical providers for the job that they are doing. And I think it's important to also realize that the group of people who have made the effort to come to this talk, this is a self-selecting group. And so I imagine that many of the providers here are doing a better than average job discussing these issues with people. With that disclaimer, we are not doing a great job in the medical community of talking about sexual health with patients. I mean, it's not good. We're not, and we're not talking just about general practitioners. I think there's this idea that, you go to your GP and they're the ones responsible for talking about this. Yes, GPs are not generally doing this. I'm going to show you guys some stats in a couple minutes. But sexual health is something that should be discussed with all medical providers, right? I mean, for example, let's say you are going through cancer treatment. This is something your oncologist should bring up to you. What effect might chemo have on your sexual functioning, your sexual desire, your sexual abilities? This should be addressed with you before you start treatment, so you have a sense of what's going on. If you see an endocrinologist, are they talking about, hey, you're taking these medications, this might decrease sexual desire, this might cause these physical issues? All of this stuff is important, first of all, so that you can be informed about what it is that is going on with your body, and so that you can take correct steps, to take care of yourself. Sorry, I can't see the slides. Can we just move on to the next slide? Apologies. So I pulled a study of 27,000 patients. So that's a really good sample size. What this study showed is that more than 50% identified at least one sexual problem. And in this study, problem was defined as a physical problem. So a lack of arousal, an inability to orgasm. That's how they defined it for this study. So 50% of people, so 13,500 people identified a concern. 19% had sought out medical care for this on their own, had felt sort of empowered and able to talk to their healthcare providers about this. And only 9%, so essentially less than 1 in 10 people, had been asked about their sexual health in their last 3 years. And this is across the board, right? This is men, women. The study was 18 through 70 across all medical providers. Less than 1 in 10. That's not great. We would like to see that number be far greater. So this means lots of people are having these issues. They are not getting addressed, both because providers are not asking and people are not feeling comfortable talking about it themselves. and bringing it up to their medical providers. And so part of what we want to sort of move into in the next phase of the talk is how to get people and help them be more comfortable having these discussions. Another stat that we found was that less than 66% of OBGYNs routinely asked about sexual activity, only 40% inquired about problems, and less than 29% asked about sexual satisfaction. And when you think about that, when you think of an OBGYN, this is a medical provider whose job is largely related to sex and sexuality and sexual functioning. Not entirely, but largely. And so if these are the stats that we're getting from OBGYNs, I would have to imagine that other medical providers who do not necessarily directly work in this area are asking even less. And so we could do a whole talk on this particular issue, but I think the main takeaway point here is that we really need to work together and to help medical providers become more aware of this. And that is really important. And in the meantime, all the more reason that people have to be empowered to advocate for themselves, in the likelihood that their medical providers are not doing this. It's a work in progress, certainly.
Yeah, I mean, I think that this is a little like twofold in that, like, we want to see providers doing a better job of this. And also we know as consumers, until we start pressing the issue and we start poking our providers about it and expressing that, like, this is a thing that we need and this is a thing that we have a right to, that we're not going to, we have to do both of those things. We got
absolutely. And we wanted to take a minute just to talk, sort of specifically about some HIV-related concerns. One of the things about this conference is that historically, and I know, Kyle, you may have more recent data on this, I know that the overwhelming majority of attendees at this conference come from the greater Philadelphia area. And this is a large urban setting, which means sort of in our area, there is certainly still stigma related to being HIV positive, but it is, I believe, far less than you might find in more rural settings, towards the middle of the country, this kind of thing. So I think it's easy for us to forget that stigma related to HIV still very much exists. And it is far more prevalent than, we would like to think. But given that reality, how do people feel about talking to their medical providers about HIV specific concerns? I know that certain clients I've had, didn't disclose their HIV status to certain medical providers. And you hear that and you think, my God, like, how do you get appropriate treatment if you can't talk about that? But they were so afraid of being judged, of being stigmatized, of being thought of as, oh, you must have, gotten HIV from behaving in this way that I have a lot of judgments and feelings about, that they were not able to get the proper health care, which is hugely, a problem. Specifically also related to sexual needs and challenges, as you all know, HIV medication has come so far and is much more tolerable, and there are many, many fewer side effects than we have historically seen. However, there are still side effects that people experience. We see things like fatigue and depression and vomiting and diarrhea. How sexy do you feel when you are tired, depressed, and have diarrhea? I'm going to go out on a limb and say you probably don't. I certainly would not. And how does that affect sort of your sexual health, your sexual interest, and abilities? When you have to take this medication and you have to take it every day, and hopefully there are ways to manage these side effects, but sometimes there are not for whatever reason. And how do you both keep yourself healthy with an undetectable viral load and keep yourself sexually healthy and fulfilled? And how do you manage those two things together? Because you can't not take the meds and also saying, well, I guess you're just going to have an unhappy, unhealthy relationship to sex and sexuality. Those do not seem like good options. And so how do we work with that? And then, for couples or for groups of people who are serodiscordant in their HIV status, how do you negotiate that? Are you using condoms? Are you using different forms of protection? Have you decided not to do that? These are all things that need to be talked about, and you need to be talking about it with a medical provider that you feel is not judgmental. There is a lot of judgment still, about how people choose to negotiate these things and manage them. And as we all know, you feel judged, you're not going to talk about it, and you are not going to have your needs met. So these are some sort of really specific concerns. Beyond that, we know that up to 50% of HIV positive men report having issues with erectile dysfunction, and 33% in a recent study from 2018 reported difficulty or inability to have an orgasm. That's a big percentage. And so, these are, again, issues that need to be able to be openly discussed with a healthcare provider and often with a therapist to negotiate, okay, we have these challenges. How do we both respect them, take care of ourselves, deal with it, and also have a healthy, fulfilling, relationship with sex and sexuality? Those things need to be able to exist together, not one or the other. I don't know if there's anything you wanted to add there, Ren.
I think no, I mean, I think you kind of hit all the pieces. I think one thing that's coming up for me that also seems to be coming up kind of in the comments is that, like, this isn't just about medical providers, right? Like all of, basically kind of all of these different roles that we have: social workers, therapists, psychologists, pharmacists, right? Someone mentioned pharmacists in the comments. Like, we all have a role and a position, really a position to share knowledge, right? And to like engage people in these conversations that can be really valuable to the patients, to the clients, to the customers, whatever your role is in the medical system, you do have some power to have a positive impact and like engage in these conversations with your folks.
Absolutely.
It's really important.
Yeah, I just want to say I'm catching up on some of these questions, which we definitely will respond to. But the answer is yes, I will make sure that everybody has slides and all of our citations from studies available at the end of this. So yes, you will all have that.
Yeah, I'm trying to like keep up with all of
I know, with the questions on the top. Yeah.
I'm really glad that people are commenting, and
Me too.
I hope, everyone continues to do that. And if we haven't hit your questions yet, I hope at least by the end of
we are really going to try to get to all of them.
Yeah. All right. So why is it valuable that my provider address my sexual health, right? I think that it seems by the comments that a lot of us are like feeling the same, like, yes, this is a thing that we need, which is great. But I'm also going to like kind of identify some of the parts that feel important to me as to like what should be a goal and why we do feel driven and motivated to push forward with this. So I kind of split it, in that same kind of category. So impact on physical sexual health. So if you can talk to, if you can talk to your providers, if you can receive that education specifically from the experts, and you can discuss your sexual practices, then you can engage in those sexual practices. You can take those things home. You can take that information home. You can use it, and that's really going to impact your sexual health and kind of communal sexual health, right? In the reducing the rates of STIs. That's a typo on my slide. Sorry. Let me see. Okay, so talking to your doctor about your sexual health, I think is really important, because sometimes we don't, especially around sex, if we feel quiet that we can't talk about what our body's doing, that can be really useful information for a provider. You might say, hey, I'm having this issue, and they can identify what that symptom is, that if there is a physical medical thing that's happening that needs to be identified and treated, you have to be able to tell your doctor about it for them to be able to treat it, right? So if we can have the conversation, we can identify, diagnose, early intervention, better treatment for sexual functioning, STIs, kind of all that physical sexual stuff we talked about. Impact on mental sexual health. So talking to your doctor about your sexual health, getting the treatment that you need, getting the support that you need, I think especially when we're talking about talking to therapists or social workers really has the power to improve your sexual pleasure in your sex life, right? We keep talking about, one thing that keeps coming up in the comments is talking about trauma and a trauma-informed perspective, and being able to have a person in your life, if that's a therapist, a counselor of some sort, that you can talk through the way that your trauma is impacting your sex life. I think that can help you kind of work through this stuff and get to the goal of a more fulfilling sex life. Also, like, sex improves, like, sex releases dopamine and serotonin, and like is a great source of stress relief, and like can be a really awesome experience for like building self-esteem. And I think that when you can really lean into the conversations about sex, you can really lean into kind of picking apart what's important for you, and you can really lean into your sexual experience, it can have such a positive impact on your mental health.
I just wanted to comment on one thing you had said, Ren.
Yeah.
I noticed a comment in the questions about the need for medical providers to build rapport and trust with patients, which I think was an excellent point that maybe we glossed over a little bit. For many people, even as they're becoming more comfortable talking about this, you maybe don't want to sit down with a complete stranger and say, so let me tell you all about the problems I'm having in my sex life. Person whose name I don't know and maybe just got off of a list from my insurance company. I could certainly understand why you might not want to do that. There are a lot of challenges around this because, especially with the direction that managed care is going, very often people are having these experiences where they go into their doctor, they have 15 minutes, the person maybe doesn't even know who they are and has grabbed a chart off of a wall and kind of comes in and looks at their clipboard and says, hi, what are you here for? What do you want? And so, when we start to talk about how do you advocate for this, one of the things that I think is going to be really important is talking about how do you create that relationship under this time pressure? And also, how do you keep in mind for yourself that your doctor is a person that works for you, right? It's not the other way around. We'll talk more about that. But this is a person that works for you, and if you are not comfortable with them, you don't have to see them. You can fire them. You can see somebody else. If you are not comfortable, in the same way if you're not comfortable talking to your therapist about things, if you're not comfortable talking about these issues with your medical provider, you're not going to tell them the important things. They're not going to be able to help you. You're not going to get the care that you need, and then nobody wins. And so that becomes, I think, extremely important.
So impact on mental health, when we're talking about our doctors and our engagement with our doctor, one thing that I think is really important that I put here is the idea that being able to go to your doctors and having a medical experience without judgment, and specifically an affirmative medical experience where your medical provider really takes the time to like know you and like you, and is wants to ask the questions and wants to make sure that the healthcare that they're providing is for you. It really has the power, one, to be a positive mental health experience, right? Like that's, I think, especially when we're talking about LGBTQ population, that to have someone who affirms your identity is like it's like a drop in the bucket, right? Like it builds that confidence, it builds that comfort. It's a positive experience, especially in a world where there might not be a lot of those. There's a lot of there's some research on the experience of discrimination within medical visits, and how many folks within the LGBTQI community don't return to the doctors because they had such a horrible experience, because their doctor was not affirming, because their doctor was discriminatory, because the people within the practice acted in a way that was painful and hurtful for them, right? And so folks just don't come back. And like that has, that has an impact on your physical health long term, right? If you can't go to the doctors because it's such a negative experience, you're not going to go when you're sick. You're not going to go when you need a checkup. You're not going to catch these things early. You're not going to get treatment for the stuff you need treatment for. So I think it can be, having a positive experience with a doctor can be a good not only does it keep us from all of those negative impacts, but it also can be a really positive mental and emotional experience. I think I also bring that up as far as like reparative medical experiences. I am sure, I can speak for myself that I have had some shitty medical experiences.
Oh, me too. Oh, yeah.
But, I've had really bad experiences with providers, and it has caused me to feel some level of fear going back to the doctors or going back to that specific medical office or building or hospital, right? And to have one experience with a doctor who can do this well and gives you the time and validates your existence and your needs can be really reparative in terms of your willingness to go to the doctor the next time or the time after that. Okay, so impact on social well-being. So I think talking to your doctor about sexual health, talking to your providers about sexual health improves your sexual pleasure and sex life. We talked about that, which also has a positive impact on relationship and intimacy. If sex is a way that you feel close to your partner or partners, then great. When your sex is improving, then maybe your closeness is improving, right, with your partners. Maybe your relationship quality is improving. And again, I say that right? Like, I think some of this is also, like we talked about that, it's not one size fits all, right? If that is a thing that's important for you in your relationship, that it has the potential to improve your romantic or intimate relationship with that partner or partners.
And if it is not, do you have a medical provider who gets that and affirms that and, isn't judgmental about it? Because it's, what people find important to them is entirely personal.
Yes. To your doctor about sexual health or to your providers, I think also improves your ability to talk to your partner or partners about your sexual practices and about consent. If we are having these conversations with professionals, if also professionals are giving us language and helping us frame things, understand things, put words to things, then we can take that language, we can take that knowledge, and we can bring it into our conversation with our partners, which I think has the potential to impact our pleasure, has the potential to impact our sexual health, has the potential to impact our relationship, has the potential to impact the way we navigate consent. I think it's really powerful. I do. Sorry, I get excited about things. All right. Were there any questions or feedback? Dana, do you have any thoughts? Anything I didn't hit?
Only that I am noticing my own anxiety about, God, I don't want to run out of time because there's so much more stuff we have to talk about. So no, I think you covered that really well. I think I'm going to leave it at that in the interest of us getting through everything we want to. So now what do we do about all this, and how do you find the right kind of provider who will do that? I started to rant about this earlier. I think Rand and I are going to sort of tag team this next section, but just really quickly, your medical provider is someone that you have hired to do a job for you, right? I think, as a culture, we sort of have this sort of power differential that we look at, that this is the expert and I have to listen to them and do what they say and they know what's best. That is not necessarily true. This is someone who has gone to medical school, who has hopefully a lot of knowledge about certain things. Are they a caring, supportive professional that, affirms you and makes you feel good about yourself and makes you feel safe and treats you well? Hopefully, but maybe not. You have hired them. If that doesn't work for you, if they are not the right person, you pick someone else and you fire that person. Every single psychologist I've ever known has had a client who has said, hey, listen, you're just not the right person for me. That is part of being a professional. You don't have to scream and yell at this person and tell them that they are the worst medical provider you've ever met, but they are not the right person for you, and that is fine. I know often, especially again with managed care, we get our insurance cards and it says, hey, you're going to see this doctor. Which I think is generated from a list of random doctors who take your insurance. You don't have to see that person. You have choices in your healthcare. And although it often involves navigating a lot of bureaucracy, you can switch your doctor. And that is something to keep in mind. I will end my rant about there right there. But that is really important. But when you go to see your provider, what are some of the things that you should be looking out for that make you feel that should give you some idea that this may be a person who is aware and affirmative and sort of thinks about these things? When you fill out your initial paperwork, when you go on their website, when you go on their Facebook page, do they talk about sexual health? Do they talk about LGBT competency? Do they talk about sort of areas that they can refer you to for specialized care? What do you see in their office? Are there equality symbols? Is there information about PrEP? Are they giving out condoms? Are they giving out lube? What kind of condoms are they giving out? What are they asking you? When they see you, do they say, hi, Mr. Kyle, how is your wife today? That's probably not a great sign, right? Who is to say that Mr. Kyle, admittedly, I'm not sure I can pronounce your last name correctly, which is why you're Mr. Kyle, but go with me. Who is to say Mr. Kyle has a wife or likes women or, you know, is interested in being with one person or not? I mean, there are a huge number of assumptions. How about, hi, how are you? That's a great, you know, and then facilitating this conversation. Are they assuming your gender? Are they using inclusive language? These are all signs, I think, that this is at least a provider who is knowledgeable and thinking about these things. Again, does not necessarily mean it's the right provider for you, but that's a good place to start.
Yeah, I think I also want to like highlight the idea that some often a provider's willingness to ask too, I think is really important, or willingness to be like curious rather than making assumptions.
Right.
And how well do they take corrections, right? When you do advocate for yourself and say, oh, actually it's that, you know, like how well can they like roll with those punches? How willing are they to listen to you and actually like take the time to hear what you're saying and validate it and acknowledge it? Do you need next? Where am I? What's going on?
Where are we? What can they do?
I was at, what do you hear? Did you get through all of that?
That's where I was too. All right, we're good. We got this. Okay. Do you want to take this one? You take this one. Let's take this one.
What do you hear?
Yeah, go for it.
Okay, so I think that's kind of what I'm speaking to is you know, Dana talks about, does the provider use inclusive language when speaking? You know, again, I feel like I a lot of these slides say doctor, and I wish they all said provider, because I'm finding myself like this does apply not only to your medical provider, it also applies to mental health, to everything. So is the doctor using inclusive language? I think what's important is the doctor talking about pleasure. When they're talking about your sexual health, are they only focusing on function? Have they only chosen one of these three big areas of sexual health to focus on? Right. Or are they making space to like acknowledge that like these other two categories are really important too, and like we can talk about them in this space, and we should talk about them in this space?
I have to say, the number of times that I have spoken to a client and I've asked about their sexual health, and I've asked about, are they enjoying sex, and they've looked at me like their head is about to explode, and then kind of been like, no one has ever asked me that before, and I'm super embarrassed, or like, maybe I'm happy you asked, but really like head exploding out to here certainly leads me to think, and certainly based on my own experience, there are not a whole lot of medical providers out there or professional providers in general asking about sexual pleasure. I mean, head exploding.
Yeah. And how does your doctor define sex, right? Or is your provider talking about sex beyond penetrative? You know, are we talking about a wider definition of sex? Is your provider empowering you to verbalize what your definition of says? And do they validate that and acknowledge that? So then we move on to what can you do? And I think like we're going to drive this point home a million times.
Yes, let's just beat it to death right here. Yes. Yeah, let's do it.
Do not be afraid to doctor shop. Do not be afraid to stand up for yourself in a medical appointment or any, you know, in a therapy appointment and say, hey, this doesn't work for me. Hey, I need you to ask me about these things. Hey, I need time to talk about these things. You know, the worst that's going to happen is you leave and you find another doctor, you find another provider, you find another therapist. you have a right to this. You have a right to, so your insurance is paying this person for their time, right? You're paying this person for your time with your copays and the ridiculous amounts of money you probably pay for your insurance, right? Like, this person is hired for you. Use the time, use the space.
And if you say to your doctor, I really need to talk about these things, and they say, I have to go, I have another appointment, that gives you a lot of information about where this person's priorities are. And I would strongly advocate that you never go back to that person.
The other thing is you can ask about, schedules for STI testing. How often are we doing this? Do you do this as a regular part of my medical care, or is this going to require that I come in and specifically say, hey, this happened, I need you to do this? And can you say, I want this to be a part of my regular medical care. I don't want to have a conversation with you about this every 3 months that I come in. I want you to just do it.
And I think that's so important, Ren, because a lot of people are not going to be comfortable coming in saying, hey, this happened, so I need to be tested. And if it is just a routine part of care, you know that these things will get taken care of without forcing people into a position that they may not be comfortable talking about.
And push, I think this is where it comes to, like, push yourself to get comfortable talking about sex so that you can bring this stuff up at your next appointment. And I know that that's like a challenging thing to ask of folks, but it is to your benefit, right? And if you can, pump yourself up for these appointments, write down your questions, right? Bring them in a piece of paper. So when they try to rush in and rush out, you're like, no, wait, I gotta hit all the points. I had your questions, I brought them here for a reason.
Sure.
And practice them with your friends, practice them with your partner. Put words to it before you walk into that appointment. I think, again, we talk about power and what that feels like to be in the moment and how hard it is sometimes when you're dealing with that power, that little room, the we're doing this, we're rushing. If you've practiced this, if you've already committed to, I'm getting this question out, I'm asking this thing, then it's going to be easier for you when you're in the moment to make it happen before that appointment ends.
So with that, again, when we had originally envisioned this, we were going to do this next part as sort of an interactive group activity. We have shifted our group activity a little bit to sort of accommodate for the new medium. But what we would like is for everyone to open the question and answer section if you're not already on there. Did I do something wrong? Good.
Oh, no, I'm pointing.
Okay, you're prompting people. I wasn't sure if I had. Great, lovely. And we will try to get to all of these questions at the end, so we're not losing track of them. But if everyone can start typing in all of the words, all of the phrases that you can possibly think of that mean sex. Whatever you think of, whatever you've seen in pop culture, whatever you've seen in porn, we don't care, but everything. And I know many people who are attending this, and so for those of you I know you can do this. And I am expecting many, many, many responses. So let's just give everyone a couple minutes to try and do that.
And let's be honest, we've all been cooped up for 2 months. So this is your time to
use all that pent up energy. Give us lots of phrases. And I will be excitedly looking here and see where we are.
So we have sexy time.
Sexy tie. BDSM, consent, sorry, read to myself.
BDSM, consent, oral, anal, penetrative, head, hand job, blow job, vaginal, can't think of more, freakin', grindin', frottage, fucking, personal intimacy.
Sorry, I just read the next one.
My nieces say their parents are taking a nap. That's what I say to my cat. Screw, hump, fuck, do it, jacking, eating, head, oral, color red, sweat, black leather, getting it on. Oh wow, you guys are going in.
I am loving this. I'm very impressed. I'm thrilled.
Booty call, pussy shot, 69, doing it, screwing, getting some, getting is popular. Active blowjob, vaginal, intimate, sexual. Let's get it on. Rimming. Oh my goodness gracious, you guys are amazing. Cuddy time or smash.
Give a shout out to Kyle, who's just doing this amazing job, just like
Yeah.
running through this.
I'm efficient. I try to be.
Yeah, and you're so comfortable doing it. You're modeling exactly what we are hoping for everyone. This is great.
I try. Giving up the ass with Z's. I like that. Giving up the pussy, bump and grind. Come on, guys. Anything else?
Let's do like one more minute to get your last ones in. Don't leave Kyle hanging. That would be so sad.
This is the highlight of my day. Besides my internet almost going out right before this presentation, this is the most exciting thing.
Oh, yeah. Oh.
Balls. Yeah, okay.
Sure.
Orgy, group fuck.
Knocking boots. Knocking boots I love.
Yes.
It's just like one of my personal favorites.
Pussy power, yes. I would like to add pegging.
Yes.
Massage. I have a headache.
I'm so happy.
Cruising.
Boning. I don't know if we had boning. Like boning.
Sounding. Okay. Thank you.
Yeah.
Suck till we fuck.
Last 10 seconds. Let's look.
Train. PNP. Okay.
Cool.
And I guess we'll close that out.
Sure. I mean, you can keep them coming if you come up with others you'd really like to share, but that was sort of the initial idea. Now, can we take the next 1 minute and everyone on your honor in your own space, can you read all of those words to yourself out loud? Just in your office, wherever you are, just say them out loud. And we talk a little bit about what that experience was like. I can't mute myself or I would do it too.
Would you like me to mute you?
Please mute me so that thank you.
Was everyone able to see the whole list, or could they only see the ones that they wrote?
So as I answer, they are able to see it. So I'm going to take a moment to answer them in the box so they populate for all the viewers.
Who knew we'd make so much work for you?
We're just, keeping Kyle on their toes today.
I have to say though, these are the this is the highest level to which people have actively used the Q&A box. So
oh, that's awesome.
Yay.
That makes me very happy. Netflix and chill. Yes. Can't forget Netflix and chill.
So I'm hoping at this point people have been able to say most of them out loud. Wherever you might be, whoever might be in your office or across the hall from your office. And so I'm curious if we can get responses to people as to how it felt, even just to verbalize those terms.
And while people think that over, if I may, I'll just say that I know for myself, as a service provider, I've had to work as a provider and a consumer to be able to be comfortable with those words. You know, I definitely think growing up, we're taught, I mean, at least from the community I came from, we were taught, you know, you don't say those, you say no spot, or, you know, like some really infantilizing terminologies that
Right.
really make you embarrassed to
I
be.
was sort of embarrassed hearing you say that just now. I was kind of like,
Listen,
no spot? Like,
I
what?
mean, listen, I've heard the most
Oh,
ridiculous things.
I'm sure.
Conservative Christian community, so we'll just leave it at that. You know, you're taught that sexuality is bad, so you saying these words are bad. So, you know, becoming a professional, oftentimes we try to use the professional terms like penetrative sex, non-penetrative sex, oral sex, when, you know, as a consumer, you really just want to say blow job to your doctor, you know. And, you know, those things definitely overlap and translate. So I think it was great saying that, and I enjoyed it. So, but looks like we have some folks who kind of jumped in. Some folks said normal, liberating. Someone knows about No Place as well, so thank you. I don't feel alone. And it looks like we have a question. Someone said it was freeing. And it makes one think of recovering from religious shame-based sexual ethics. That's real.
I just want to point out also that, like we were saying before, people attending this talk, again, this is a self-selecting group of people. And so I would not be surprised if a higher than average number of people doing this activity are more comfortable than the average person might be talking about this. So, you know, for those of you that found this to be sort of liberating or sort of an interesting new way of getting comfortable with things, that's great. If you didn't, my guess is that that may also speak to the fact that you may be doing a lot of this work already in your daily practice, which is fantastic. I mean, that's what we're hoping for. And again, hopefully we're giving you some tools to help talk to your patients about this as well.
Yeah. Well, and I think about, like, even as you say these out loud, or you can type them in, right? Like, maybe this is a place that you do feel comfortable, and you're like, all right, yeah, like this is great. This is, I can do this. And now to ask you to kind of like imagine saying any of these words in your doctor's office, and like then does that change how comfortable you feel saying these things out loud? And like can this practice, you know, like, can this be one step in like, okay, I could say them out loud, like I've gotten to the point I can say them out loud alone in my office, and like this is fine, this is great. Can I say them all out loud to my partner? Can I say them all out loud to my friend? Can I say them all out loud to like my sister? Can I say that, you know, and kind of
where is my comfort level here?
Yeah, totally. And the more that you like practice that, the easier it will become to kind of say it when you are faced with more anxiety, or you are in a position that it feels a little scarier to say these things out loud.
And I was also just thinking about, you know, piggybacking on something that Kyle just said about, you know, sometimes people just want to say blowjob and they don't want to say, well, we engaged in an intimate oral act, and how that feels very sort of false and clinical. How does your medical provider respond if you say, so when I'm giving a blowjob? I mean, are they sort of horrified by this? Are they surprised that you're using this kind of language? Are they thinking, my God, this is so crass? Or are they like, yeah, okay, so let's talk about that. You know, how comfortable are they there? Are they comfortable with the language that you are comfortable using, talking about your behaviors and your needs? I think that's another really nice barometer to look at when you're looking at it with medical providers. You know, it did feel important to us to talk briefly about COVID, because COVID is, well, until sort of the immediate, but COVID has been front and center on people's minds a lot recently. It was not a thing that existed when we started talking about this presentation, but given where we are now, this outbreak and the social distancing, how does that affect medical care? How are things shifting? Telehealth is something that is becoming more and more common. Certainly in our clinic, our medical providers will see people in person if it is necessary for something particularly acute, but most of the appointments are being done via telehealth. For people, this can be sort of a major pro or not. Some of the benefits might be if you're less comfortable having these discussions in person, the distance of telehealth can provide people with a little more space and may help you feel safer doing that. On the flip side, I mean, I'm sitting in my office right now. You guys can't see my office. You have no idea what it looks like. You can't see your medical provider's office. If they have pride flags, if they have literature, if they have bowls of condoms, you can't see that. And so some of the physical signals that you might have to suggest to you a certain level of comfort, you may not have access to. So it's something to keep in mind. Routine testing. Sorry, Ren, go ahead.
I was just going to say, I think especially as we're talking about telehealth and we're talking about sex and like where is that line that it starts to get more and more uncomfortable, that for some people, I mean, I think it's a mixed bag, of course, in terms of what it feels like to engage in a telehealth therapy appointment or a telehealth medical appointment. But for some folks, having this distance, having the, like, we're not actually in the same room, or like we're doing this over the phone and I can't even see your face, may actually allow some people to say these things with more comfort, right? Like a little more safety of like, oh, I got just enough space that like I can finally say this thing out loud that I've been too anxious in person to say.
Yeah.
So I just wanted to raise that.
I think that's a really good point. You know, a lot of routine tests are getting postponed. I mean, we're talking about this idea that is routine STI testing part of your medical plan? A lot of those things are not being done. A lot of patients who have had undetectable viral loads for long periods of time are not getting their routine blood work done. STI testing not being done. This might be fine. It might also be incredibly problematic. And how, if you are a person who feels this is really important, how do you advocate for, hey, listen, I understand that I have to wear a mask and come in and be careful, but I need this blood work done, or I need this test done. That's important. Difficulties getting medication. From what I have heard thus far, this has not been a huge issue from people I have spoken to. I did speak to a couple of medical supply companies who have reported sort of that they aren't having any backlog at the moment. But again, we don't know how long this is going to go on. We don't know how widespread the pandemic is going to be, or if it might get bad in the places where the medical plants that are creating medications are being developed. So this has the potential to become a much bigger problem as the pandemic may or may not continue. And one of the things that I always like to think about is people's behavior gives you information, right? They can behave however they want, and you get to take certain information from that. And so one of the things that we get to learn about our medical providers in this situation is, what do they think is essential, right? They're saying, hey, we have to sort of alter our medical care, so we're no longer going to do STI testing, or we're sort of rushing through some things, so we're not going to talk about sexual health. Or, hey, listen, we actually have a little bit extra time because we're providing longer appointments for telehealth, and so we can talk about these other things. What gets swept under the rug, what doesn't, what gets prioritized, what doesn't, and you will get a lot of information about your medical providers that way, which can help inform choices about who you do or do not want to include in your medical team.
Yeah.
Right, did you want to piggyback on that at all?
No, I just am like, it's just the I'm Essential song just keeps going through my mind as I hear this, of like, you
should have added that for the end of the presentation, just
right?
to sort of like play.
But like, so we've got essential employees, we've got essential businesses, and it does feel like nationally, the definition of that is really different state by state, industry by industry, person by person, really. And so I do think that there is some insight into your provider's values when they start having to define what they consider essential business or not.
Absolutely. And how do those values align with your own?
Yeah. So I think we're kind of at the end of what we had brought to speak about. I'm looking at some of the questions.
Yeah, I want to go back through that and just see what we did not maybe address completely.
Mm-hmm.
And before you both begin with the questions, I just want to say you've made my job incredibly easy by being so intuitive and monitoring the questions as things have been going on. Normally, I play Andy Cohen or some sort of other talk show host, and I just read them off. So I want to thank you both for kind of keeping an eye on those as they've been going along. And while you kind of look through those questions, I just want to say to our audience, thank you for sticking with us. We've had 80 folks, give or take, steadily with us. So stay around for the question and answer. These always prove to be my favorite part of the presentation.
So I just saw a question that I think is great, and I actually hadn't thought that much about it before, so I really appreciate this. The question is, how do you feel about pharmacy having a role in speaking to patients about their sexual health? I love it. I think it's fantastic. You know, it is not something that I immediately sort of imagine. When I think of the pharmacist, I picture myself going to CVS to get my medication and them yelling like, Lehman, your whatever medication is ready. And my thinking, dear God, has HIPAA completely gone out the window? And so I do think that, you know, there have to be certain barriers put in place. I mean, if they're yelling at me about Synthroid, I don't think I want them sort of yelling at me about potential erectile dysfunction from a medication. But, you know, it's the pharmacist's job to think about side effects and interactions and to catch things that maybe an MD hasn't, and to really know how these medications work and what role they play in their body. So, you know, I'm certainly not the expert on pharmacy, but I love the idea of someone with that kind of knowledge speaking to patients about, hey, you know, I don't know if your doctor mentioned this, but this medication you're taking could have this side effect, and it's something you might want to think about.
Yeah. I mean, I think, right, I think anyone who's willing to have these conversations, because there are so many folks who are not having these conversations, any provider who's willing to, I think that's a great idea. I do think what comes up for me in terms of the pharmacy is really thinking about like how trauma informed, how like HIPAA compliant can these conversations be?
Yeah.
And do you have a pharmacist who you have a relationship with, right? Like a lot of people, like maybe that's the pharmacy you go to every week, and like you know, you and the pharmacist are buddies. You talk, you know, you talk all the time. And is this pharmacist, like, I feel like so many pharmacies have those little like private consultation areas, you know, but I don't know that I ever see anyone in there. So I wonder how trauma informed a pharmacist might be in like starting that discussion with a customer, patient, client, and also, do you feel comfortable advocating for your privacy? Do you feel comfortable saying, whoa, like, can we like talk about this somewhere else? Or
not
like,
in the middle of CVS, please.
Yeah, you know, or kind of this like, I'll talk to my doctor about it. Like, thanks for bringing it up, but I'm gonna talk to somebody who I feel more comfortable talking about it with.
You know, it's interesting because there's another question here. I can't find it exactly, but it was something about, have you heard anything about, here it is. Are you aware of any efforts being made to educate medical providers about how to talk with patients about sexual health, maybe while still in medical school? Let me just say that is a thing that Ren and I have both talked about extensively for a very long time, about how absolutely essential that is. I am not personally aware of any efforts in particular. I mean, I know, you know, med school does some basic sexual health, but I don't think, you know, it comes nearly close to talking about this or talking about how to speak to patients from a trauma-informed perspective. You know, and that being a big problem. But we were talking about the pharmacy, and, you know, how great would it be if in pharmacy school, you also had some education about sexual health, about trauma-informed approaches, about how to do that. In med school, in pharmacy, I mean, basically like in every profession, right? I can't really think of a profession in which this would not be beneficial. You know, because you, in whatever profession you're in, you don't know the history of the person that you're talking about. And so approaching these conversations in a sensitive way that allows for the possibility that there has been some trauma or some unwanted experience. And if there hasn't been, okay, great, but this certainly is not going to hurt. It's only going to improve things. So everybody needs to be educated about this. What else do we got here?
If I may ask a question that I kind of saw floating around a couple of times, do you have any stats on sexual health and pediatricians? And do you have a sense of how that is like discussed or taught to pediatricians as they're going through training? Because that's essentially where sexual health and education should begin in adolescence.
Earlier.
Yeah. I hate to say that I don't have too
I do not
much
either.
understanding or knowledge around that. I have my own opinions as to what I'd like it to be. I also have my own feelings as far as, I think that unfortunately, or maybe for, I don't want to say that, but like, I think that often talking about sex with kids ends up being like a very politically charged, a very morally charged kind of subject and topic. And so, beyond what kids get in their high school for sex education, I often feel like anything beyond that becomes a like, oh, parents get to choose, parents get to decide what they say or how they teach it or how early they teach it or what they want to teach. And we really like kind of put it off to be a family choice and family decision. And I guess in that way, I'm a parent myself, and I often think about how my parenting is part of my way to like make change in the world, and that I can kind of be like, okay, I've decided that I'm going to talk about sex with my kids in this way, and I'm committed to doing that, and I'm going to like advocate for my kids with their providers. I'm going to advocate for my kids in their school to make sure that like we're doing things the way that like I think my kids need. Yeah.
So do you think there should be sex ed classes for parents, like how to talk to your kids?
Yes, dear God, yes.
I actually, in grad school, this is a total aside, but actually in grad school, I had to develop if I was to create a program, what would I do? And it was exactly that, a curriculum for parents to talk about sex with their kids. And oh yeah, that would be like my fantasy. I think that would be amazing.
What not to
What
not to say for parents? Don't use these terms. Use
right.
the
And thinking about what your nonverbals communicate, and how comfortable you are. If you are feeling really uncomfortable having this conversation, you're not that good of an actor or an actress. Like, you're just not. Kids know these things, right? And that sends a certain message and can create feelings of shame or, disinterest, and all of these things have that ripple effect. Yeah, Ren, in your abundant free time, why don't you do that? I think that would be so great. It'd be great.
Looking at some of these questions on here, I want to address this question. It is, in the South, there are a few providers who specialize in HIV care who are willing to see HIV patients due to stigma, who are Ryan White funded. A lot of HIV plus folks here feel stuck with their providers because there are no other providers they can go to with their financial limitations or literally lack of available services. What do you suggest for folks living in areas with limited access to care? I think that's such an important question. I think that even in making this presentation, there is a lot of there's a lot of privilege that's required to enact some of these recommendations or some of these suggestions, right? You have to have you have to have options in order to be able to fire your doctor. And so I think that a lot of our recommendations or suggestions are pretty idealistic. And I think even if you can pull some of them or maybe one or two of them, then like that's progress to me, and that feels worth the discussion. I think I definitely want to acknowledge that there are barriers.
Sorry, go ahead.
No, go ahead.
I was just saying, I was thinking about that too, and one of the things I wonder is, in situations where that is not an option, because we're in Philadelphia. There are a lot of HIV providers here. This is very fortunate. Where this person in the South with a question, that's a really good point. I think one of the things to think about is, if you are in a situation where that is just not possible, and that certainly will be the reality for many people, when you go to these medical appointments, is there a way that you might be comfortable bringing someone with you, someone who supports you, whose values align with yours, who's affirming of you, who can remind you that, hey, listen, just because this medical provider is dismissing of this or doesn't think this is important, like, you are okay, and what you think is valid and counts. And sometimes it's really helpful to have a supportive person remind you of these things, especially when you're in a situation where you feel like you're really stuck and you don't have a lot of choice. So that's certainly one thing that I would try to keep in mind.
Yeah, I mean, think about who your team is, right? You may be stuck
Who's got your back?
you may be stuck with a primary care or an HIV specialist who does not align with your values or what you need, but maybe you have a therapist that really does, or maybe you have peers or friends who really do, that can kind of
maybe you have an online support group.
Those
can be really great resources.
Yeah, I mean, I think that the internet can be a really excellent, valuable resource. I think there's a lot of like stuff out there, you got to be like thoughtful about whether, check your sources and stuff like that. But like, there are providers nationwide that you can follow on Instagram, that you can follow online, that you can go to their website, that you can go there for the education and for the resources and the knowledge that your provider might not be able to provide or isn't providing. And also, there is a part of me that feels really hopeful that this whole COVID thing has pushed so many of us to go remote, and has really pushed the states to rethink how they think about licensure and location for providers, all of this stuff. And I'm really, really hoping, again, this is my like kind of idealistic, like in a perfect world, right?
We need some idealism right now. It's good.
Right. But I'm hoping that one thing that can come out of this is more flexibility around televisits, around state by state licensure or ability to practice, that you could be someone in a state where you don't have a lot of resources and you could have a therapist who is competent and just happens to live in another state, or you could have a provider who can coordinate with what's in person, so that web of what's available to you can be significantly expanded.
Yeah. Probably could do like one more.
Yeah, I was gonna say we're coming up on time in a few minutes. So if you see any other questions,
just to reiterate what I said before, Kyle, who is the tech person in this group here, I'll make sure that they have all of the slides and they can share them, and I will give all the stats, all that stuff. I will give the citations for that, so everybody has them. Study.
Looks like Julia mentioned that Our Whole Lives is a sexuality curriculum that includes hours of training for parents. So that's exciting. I'll have to do more research on that.
Oh, thanks, Julia.
And one of the good things about webinars is a lot of the time professionals get to connect. So yeah, definitely send that over, Julia. Yeah, and I just want to thank everyone once again for being so engaging and taking the time to ask these questions. A lot of them are really good. I'm particularly moved by like the folks who said how it made them feel to say those words out loud.
I really appreciate how engaged everybody was. This is my first time doing an online webinar, and I was sort of thinking, I don't know, this could be super weird. What if, everybody's over there eating snacks and not paying any attention? What if everyone hates it? I really appreciate how many thoughtful questions we had. It really.
Yeah, I think Dana and I were both really disappointed when we heard that we weren't going to be able to see everyone's faces or to hear, people speak. And so I think I've been extremely pleasantly surprised how easy this has felt and how actually connected to the audience I do feel.
Yeah, I was surprised by that. Makes me feel really good. I know, Kyle, you had mentioned that there's a possibility of continuing to do trainings and seminars in this forum, and you said that before, and I was kind of like, really? I mean, I don't know. But I am like Red, I'm pleasantly surprised by this. I'm feeling really good about it.
Yeah, I think the benefit of doing this in this mode, I mean, one, I'm in my house, but two, I'm in my house. You know, I get to go home after this. So I think as providers and as consumers, we're all trying to navigate how to compartmentalize our space.
Yeah.
How we're trying to compartmentalize our sexual health. How do we talk to our doctor or our therapist about our sex life in our house, especially, let's say if our partner is in the house and they have headphones on, you're trying to talk about that with your therapist or your doctor. So I think it's all related. And with that said, if there are no more questions that kind of stick out, I could just close this out and say thank you to you both.
Thank you to you for facilitating this, and thank you everyone for coming.
Yeah, everyone, just as a note, as we close this webinar out, there will be a pop-up screen that will lead you to a survey. With that survey, you can just let us know how we're doing, and to the speakers, we'll let you know how that goes as well.
Great. Yeah, feedback would be great.
So, and don't forget to join us tomorrow for our next webinar entitled, Why is Rona Doing the Most, Especially in the Black Community? It's hopefully going to be a really engaging webinar, and you can just register for that on our fight.org/cheetah page, and then just navigate to where it says AIDS Education Month. So without further ado, thank you again.
Thanks, everyone.
See you tomorrow. Bye-bye.
Bye, all.